New numbers show a significant increase in coronavirus cases as more Omicron subvariants trigger fresh infections. How will the government assure protection will be provided again amid waning vaccine immunity? And as public health is always political, how quickly health officials can decide over a second booster for all. Good evening, I'm Pia Hontiveros. Welcome to your weekly political appointment fix politics as usual. Our guests tonight, joining us via Zoom, are officer in charge of the Health Department, Undersecretary Maria Rosario Vergere. Octa Research Fellow Ranjit Rai will be joining us in a bit, and infectious diseases expert Dr. Jean Solante, who is, Ranjit is here na rin with us. And Dr. Jean Solante, who, if I'm not mistaken, is still with the vaccine experts panel. Good evening po, Yusek Vergere, OIC Vergere, and Dr. Rai, Dr. Solante. Thank you very much for being with us. I'm correct, no, Dr. Solante, still with the vaccine experts panel?
Yeah, but the vaccine expert panel is not any more active, Pia.
Okay. Because of yung National Task Force Against COVID-19, turned over all functions to the, what is it ba? OCD and the RMC?
Yeah, after the term of Sec Duque, I think one of that is the VP also has been dissolved.
All right, everything in transition, but we still have a lot to talk about tonight. So I wanted to begin with Yusek Vergere, who is still officer in charge of the Health Department. Ma'am, let's begin with this, yung mga cases increasing. So we have not yet seen the peak. What are we going to see? What are the numbers that we're looking at? And when is this going to happen?
As we have said, we have explained that for the DOH, based on our trends and projections, we have not seen the peak yet, and we are not seeing that it's going to peak in the next few days because we have these projections wherein by the end of July, the cases might still increase by as much as 11,000 cases. No, if the minimum public health standards would continue to be reduced, and also if mobility will be increasing, no, as we have it right now, which is like it's pre-pandemic already. And of course, we know that the BA.5 and BA.4, these subvariants of Omicron are here, and all of the regions are affected already.
Also with us, Octa Research Fellow Ranjit Rai. Sir, what do you have in your data in terms of peak and number of cases?
Well, we have the same. Good evening, Pia, and to Dr. Solante, and Yusek Vergere. Octa has already published its own projections, and we're keeping to those projections. So we are seeing a peak somewhere in the vicinity of 7 to 10 days. So we could be wrong, but Yusek Vergere is right. It could still go up. But this peak we're seeing only in the National Capital Region. For most of the country, as Yusek Vergere has already reported today and recently, cases are still rising.
Mm-hmm. But we're not going to have another surge, are we? Because, in our recent history, we had the Delta surge, for example, in September, and everybody remembers how horrible that was compared to, in a sense, the Omicron surge in January. Are we looking at something like that, or with more vaccines coming, more people getting vaccinated and boosted, we're not going to see that so far? Dr. Solante, can you take that first?
Yeah. First, Pia, I would like to give some importance of the characteristics of this BA.5.
Okay.
This is one of the evasive among the variants of concern. In fact, there are data to tell us that it's 4 times more resistant to the current vaccine. So that means that we're looking at 2 very important populations that will get the infection. And we're also looking at that and experiencing that on the ground. One are those because of breakthrough infections. So meaning they have received their vaccines, they even received their first booster, and yet they got the infection. The second are those with reinfections, so which means that they have been exposed before, or even they have vaccine plus re-exposure, and then they still can get the infection. Now, my thought on this is that in 70 million is 70 million primary vaccinated, and that's significant enough to protect us against severe infection. But with the booster dose that is still very low, then this is where the problem is, because if you will have this BA5, then you are still at risk of getting the infection. Now, my outlook for this is that we may have a slow peak, and we also have a slow decrease in the cases, because most likely it will really affect all that will be exposed to this virus.
Pero hindi po siya, comparing it to the Omicron surge in January, this is milder or as mild, or how are we? Because, syempre ang iniisip ng tao, what is it going to be like? And sometimes, only if you get it, that's how you can, really describe it, I guess. So is it, pareho lang po ba siya sa nangyari nung January? Same symptoms, same level of discomfort, same kind of infection?
Yeah. Most of the time when we look at and compare the manifestations in January and what we have now, more or less it's totally the same. The milder the presentation with sore throat, cough, and low-grade fever. And usually I have observed 3 to 5 days. That's the duration of the symptoms, and it's out. And these are usually seen among those who are fully vaccinated and with booster. But again, I would like to make this caution also that it doesn't mean you have a mild disease, everyone will just be getting the milder symptoms, because we're seeing also now in the hospitals, those with comorbidities, those who are elderly, getting the more severe form of the infection, especially those with comorbidities.
Mm-hmm. And those with comorbidities and the elderly, who get the severe form of the infection, they're still vaccinated and boosted also, or hindi?
Yes, a lot of them, but a lot of them are the unvaccinated compared to those who have received the booster or the second booster.
Mm-hmm. Which brings us to the issue of vaccination. So I wanted to begin, Yusek Vergere. Let's talk about this Pinas Lakas, this new program. Can you describe it to us, and how are you going to convince people this time around? President Marcos himself came out with a promotion video for it, speaking on behalf of vaccination. What else are you going to do, and can you really get this off the ground?
Well, this Pinas Lakas campaign was born out of the directives of the President for us to ramp up vaccination, especially the booster doses, the first booster doses across the areas of the country. So this would be done in this first 100 days of the administration. It's equivalent to 60 working days, where we are targeting the most vulnerable among the population, the senior citizens, that we should be able to ramp up the vaccination and cover as much like 90% of the senior citizens. Also, part of this would be for the first booster shots, where we are targeting 50% of the eligible population. So we are looking at around 23 million eligible Filipinos for these first booster shots that we will vaccinate. What is the main strategy for this would be that we will be bringing the vaccines closer to the community. So we are going to do this by settings approach, where we go to the communities, go to markets, go to these big workplaces or factories. We go to the schools. Also, we go to churches and the other places where people would usually go to. Aside from that, we are also going to have this house-to-house campaign, especially for our elderly, so that we can map out. No, this is our last mile for them, because we have already reached 77.7% among our senior citizens. We are looking at 1 million target for our senior citizens for these next 60 days in the first 100 days of the President.
Do you foresee, Yusek Vergere, that this will be the most challenging part of the program? Because you have, like you said, senior citizens who are not yet boosted, and I've heard, and there are some na hindi pa rin bakunado kahit yung first or second dose. How challenging is this going to be? Because they have many reasons not to get vaccinated and not to get boosted. How are you going to convince them?
Well, it's quite challenging, really, because first, this is the last mile. We've already covered those who are really interested with the vaccines. Now we are going after these hesitant senior citizens or even those for the first boosters. So we need a lot of help coming from all stakeholders. That's why we have already met with some of our stakeholders so that we can get their support and we can all have this intensive vaccination efforts. One of the things that came out from our latest survey would be that people are not receiving their first boosters for boosters because they are confident already with these 2 doses that they have. And they say that it is not really needed for work, it is not really needed for public spaces, so you don't need to get your first booster. So this is one of the things that we are trying to emphasize in every media outing that we have and also for information dissemination, that we all need the first booster shot so that our immunity will up again and we will have that wall of immunity for the population.
In other words, hindi pa rin po tayo fully protected if we don't have even the first booster shot. We're going to take a very quick break. Our guests, USEC Maria Rosario Vergere of the DOH, OIC of the DOH, and Professor Ranjit Rai of OCTA Research Fellow and Infectious Diseases Expert, Dr. Ron Jean Solante, still joining us. More from our guests after this quick break. Stay tuned. Welcome back. This is Politics as Usual. Still with me are DOH, OIC, Maria Rosario Vergere, OCTA Research Fellow Ranjit Rai, and Infectious Diseases Expert, Dr. Ron Jean Solante, all joining us via Zoom. Kanina lang po, binanggit na po ni USEC Vergere na in so many words, hindi po optional ang booster shot, the first booster shot, especially for the healthcare workers, senior citizens, and those with comorbidities. Dr. Solante and Professor Rai, can you boost this argument? Professor Ranjit Rai, kayo po muna, sir.
Yeah, we're in is in full support of the efforts of USEC Vergere and the Department of Health. In fact, we are part of a consortium of different organizations pushing for the first booster shot, no, at the very least. No? In our campaign, we're using isa pa, pero right now we're going to adopt pinalakas and of course in our media efforts and initiatives, we will continue to to encourage our countrymen, no, to take the first booster shot.
Dr. Solante?
Yes, Pia. So I think it's important that when we communicate with the people, especially for those who has not received yet the first booster or the second booster, that the variant that we're facing now is totally different from the original strain. And remember, these vaccines initially are being studied against the original strain. Now, the fact that receiving the primary vaccine is not enough, then this will more be important that receiving the first booster will really give you protection, not necessarily against the infection, but more or less against the severe infection. And that goes also with the second booster for the vulnerable population, because what we want to protect now is developing the severe infection and putting all of this in the hospital so that we can still maintain a viable health system. That's why we always have to emphasize why booster is important, because the primary vaccine series is not working anymore.
There's plenty of concern right now because of so many issues, stocks, balitang-balita yung ang dami po nating bakuna available, and then there's that hesitancy na merong ayaw naman magpabakuna, tapos nandyan lang yung vaccines waiting for willing vaccinees. And then nandoon po kasi yung mga kunyari halimbawa ako nagpa-first booster shot nung January, and because I go to work and because I'm out every day, my concern is when can I get a second booster? But USEC Vergere, there is a process that you're following, right? You're waiting for some research, some data to come in. So can you explain to us, to those of us who want a second booster but still can't get one yet?
Yes, ma'am. No? So I just like to explain to everybody. First, the DOH fully supports and understands the sentiments of our citizens of the fear of getting COVID-19 and the interest to have the second boosters. But we have to remember that the Department of Health always base our decisions on science and evidence. And currently, we still do not have enough evidence for us to support the recommendation or the policy that will say that we can already give second boosters to our general population. What we have right now, and it was supported by our FDA and the HTAC, would be that we give second boosters to those vulnerable in our population, the senior citizens, those immunocompromised, and our healthcare workers. But for the general population, sparse ang evidence para suportahan ito. Even in other countries, they only give it as optional just because of the clamor of the population also. We need to rethink, we need to review this carefully. Actually, we have already coordinated with the Food and Drug Administration requesting for further study among the 50 to 59 years old and those with comorbidities to be given second boosters. We need to wait for the decision or the recommendation of FDA so that they can amend their EUA to expand to these sectors. Up until we can get that, and we cannot issue any guidelines until then. So we have to wait, we have to be patient. Our experts are saying that up until now also, our first booster shot is still effective against the severe forms of the disease.
It is July 20 now, ma'am. When do we expect a decision from the FDA on this?
Actually, we had a meeting with them yesterday, and they were saying they were having a hard time. As I've said, the evidence is sparse, so they were asking also for help because they have coordinated with the different manufacturers already requesting for this evidence, and they were also trying to ask help from us so that our evidence generation unit can help them collect these different evidences at hand. So we need to wait and be patient for us to complete our evaluation and give the best recommendation for the public.
Dr. Solante, can you add to that also? Because, syempre, there is still that concern, no? But at the same time, are we saying that if we can give boosters already sa mga natitira pang mga senior citizens and those with comorbidities, that we should be confident enough that for now that will be enough for us, for that so-called wall of immunity?
Yeah, because as what I've said, what we want to protect are the vulnerable population, and protecting them against severe infection by receiving the second booster should be the priority as of this moment, because especially now we have a variant that is really evasive against the neutralizing antibody of most of these vaccines. And the data is still telling us that even if you get the infection, it doesn't also mean you get the more severe infection. So it's now getting the vaccine, protecting them against severe infection, whether it's the first booster for the general population and the second booster for the vulnerable population. That should be the priority. And I can see the sense of urgency now because only 15 or less than that are getting the first booster for the general population. But again, it's the vulnerable population that needs a lot of this protection.
Yusek Vergere, I'm sure nabalitaan na po ninyo sa DOH itong mga umiikot na info, no, that there are people from the general population who have been able to get a second booster shot. What are your thoughts on that, and what is the policy for this? Ano po ba yung advisability of something like this?
Well, first, I guess I will defer to Dr. Solante about the medical effects of these boosters that had been given, which were out of the guidelines and not recommended. First, we would like to remind all of our local governments that this is in violation of the specific guidelines that we have, also in violation of the law that we have, because according to the law, we will have vaccination sites, and these vaccination sites should be abiding with the protocols and guidelines issued out by the Department of Health. So we advise our citizens that you should wait for DOH guidelines. Some experts are saying that the more vaccines that you have, it becomes more reactogenic, especially if it is not really indicated for you. So as I've said, ma'am, I will defer to Dr. Solante about the effects of this vaccine if you have it exceeding the indicated doses for you.
Dr. Solante.
Yeah, thank you. Yeah, I agree with Yusek Rosette, no? And we are still in an EUA of these vaccines, and any adverse event that will happen to an individual getting the vaccine without or not under the recommendation, then that will really be bad, and that will only enhance or increase vaccine hesitancy. No, so that's why on our part we should abide by that, and at the same time follow the current recommendation. And again, the implication here is that we still have to target the first booster and the second booster for the vulnerable population.
So dapat ang headline po dito, advice to the general population, huwag kayo magpapa-second booster muna. Antayin muna ang guidelines. We're going to have to take a very quick break. More from our guests when we return. This is Politics as Usual. We are on our final stretch here in Politics as Usual, still with me, DOH, OIC, Undersecretary Maria Rosario Vergere, Octa Research Fellow Ranjit Rai, and infectious diseases expert Dr. Ron Jean Solante, all joining us via Zoom. I remember at the start of the pandemic and in the latter half of 2020 and before we started vaccinating, ang laki ng issue ng vaccine hesitancy. People were afraid and ang daming kumukontra, or at least sila yung maingay. I wanted to ask Professor Rai right now, what data do you have that will speak to this so-called vaccine hesitancy? How strong is it now? And meron pa bang who insist on not getting vaccinated, and what are the reasons?
Okay, so based on our last Octa Research Survey, which we conducted in April, something like 7 out of 10 Filipinos are amenable to getting a booster shot. So that's the first thing. Number two, vaccine hesitancy. If we're talking about the primary vaccine hesitancy, based on our last surveys, as 5%. It's very low. So it's just a conundrum for Octa, because while Filipinos are amenable to getting a booster shot, and while Filipinos widely accept the importance of vaccines, not too many people are going out of their way to have themselves vaccinated. And as Yusek Vergere was trying to say, we're at the last mile as far as the primary vaccines are concerned. No? We reached all our targets, most of our targets there. In the booster effort, we're still a long way to go. And I don't think there's hesitancy. There's complacency. I'm certain of it. But we are going to conduct another survey this August. And if Yusek Vergere and the Department of Health would like to add rider questions, we're going to give it for free. No? So if they have questions they want to measure, no, and to probe, let us know, and Octa will provide you a space in our latest survey, which will be conducted in the first week of August.
Oh. Professor, complacency meaning, may first and second shot na ako, okay na yan, ganon. That's what it means?
Well, I don't know. We didn't test the reasons, no? But definitely hesitancy for the booster shot. The majority of them are hesitant for two reasons. One is safety, and the other one is efficacy. So it's the same with the primary vaccine survey that we had, no? And we've had this survey for the last year, no? 4 quarters of measuring vaccine hesitancy in the country, no? So we have an extensive database, and it seems very clear that access doesn't seem to be the issue. And for the small number of people who are hesitant to get boosters, it's really safety and efficacy that are the primary reasons for being hesitant to get a booster shot.
Yusek Vergere, kanina nabanggit po, syempre, everything is in transition and we're seeing a lot of changes. But like the classification po, so right now we are still alert level 1. Can you describe in more detail, moving forward, what's it going to be looking like? No? Hindi na po alert level 1, etc., classification. Can you tell us more?
Yes, we had a meeting with the President, and specifically, based from our discussions, he has commented that the alert level system was created during that time that it was most appropriate. now that the situation has evolved, we need to look forward and try to dissociate these restrictions from the alert level. So we are moving forward and we are trying to study the alert level system wherein pagdating nung time na our situation is already stable, of course, we can be able to revise the system wherein the alert levels would just be for risk communication, communicating risk to the public and the implementing units, and we try to dissociate these restrictions from these alert levels where we are going to have generalized restrictions and not specific to the 3Cs that we have within this current alert level system.
There was an interesting announcement earlier. Well, a possible scenario, yung sinasabi po ni Presidente na pwedeng mangyaring maging optional ang mask sa mga outdoor spaces. It sounds like parang ano siya, what do you call that? Para bang hindi reward. It's like giving people an incentive. Incentive, yes. An incentive, right, Yusek Vergere? Para, sige, magpabakuna na kayo, magpa-booster kayo, and then for the ABC, second booster. So incentive siya, in other words.
Yes, actually, ma'am, when we discussed with the President, that's part of the directives. That he would want that people shift their mindset into living with the virus. And that is what we are supposed to do because we know that the virus is here to stay. But what would be most important for us is to preserve the healthcare system of the country. So he said that maybe eventually we will need to have this option of wearing mask or not when you are in outside spaces. So we explained to him that we still need to up the immunity of the population before we can do this kind of easing of restrictions, and he agreed. And so we are now going to provide this incentive eventually to our local governments who will be able to achieve the targets for our booster shots, the first booster shots, and also for their eligible population for the primary doses.
We have a minute and a half to go before the show ends, so we're going to get final words from our guests. Let's begin with Professor Ranjit Rai of Okta. Sir?
Well, for Okta Research, we're reassuring the public and our friends here, panelists, Yusek Vergere, Dr. Solante, who's a mate us in another organization, another group called the Advisory Council of Experts, under Mr. Joey Concepcion, that Okta will continue to do its monitoring of the pandemic and will continue to support the DOH in its messaging as far as encouraging our countrymen to have themselves boosted. Okta sees that there is a peak, at least in the NCR, in the next 7 to 10 days. But we are still, our messaging is clear, and together with the DOH, we're still in the midst of a surge. We should continue to be vigilant and continue to follow the minimum public health standards. And if we're not yet boosted, let's get ourselves vaccinated or boosted.
Dr. Solante?
Yeah, my message here is we have to support the booster program of the Department of Health. And we have to really emphasize the important message that when we are getting the booster shots, we're not really protecting, it's not really protecting you against the infection, but really protecting against the severe infection. And that's why we really support the first booster for the general population and for the second booster for the vulnerable population.
And Yusek Vergere?
Yes, ma'am. I guess my colleagues have already said yung importansya po ng first booster shots para sa ating populasyon. We just like to remind everybody that we have this Lakas Pinas na kampanya for the first 100 days vaccination campaign of this current administration. Ito po, sana magtulong-tulong tayo ulit. Let us all be as one. One Philippines in battling this COVID-19. And the only way for us to be able to overcome this challenge or this situation is for all of us to be vaccinated with our primary series and our first booster doses, and we continue to comply with the minimum public health standards.
Thank you so much for your time. Health Officer in Charge, Undersecretary Maria Rosario Vergere, Octo Research Fellow Ranjit Rai, and Infectious Diseases Expert Dr. Ron Jean Solante. Maraming salamat po sa inyong lahat. We have been told before, don't talk politics at the dinner table or the family reunion or in Viber groups and risk warfare, digital and otherwise. But we can talk about it here at this table on this show. Your weekly political appointment fix, politics as usual. I'm Pia Hontiveros. See you back here next Wednesday, 8 p.m.